Hey, hey. Hi, Carine. How's it going, girl?
Hi. You got me out. You got me out
I got
of
you
my
out and
hiding.
on camera. Oh
I
my
know, I
God.
know, I know, I know.
Man, I am so excited to have on this show my dearest friend, Carine. Please tell us what's been going on.
Well, what has been going on is that I've been busy being pregnant and having a baby. That's what's going on. And now busy being sleep deprived, essentially.
Yeah, so tell us a little bit about yourself because this is a new audience for you, and I
It
know they want to hear. Right. So
It is. Oh,
I
I'm so proud of
know.
you. I am so, so proud of you. This space was much needed, and I'm glad that you're stepping into it, and you're allowing women to come in and just share and being heard, right? I'm so
Mm.
proud of you.
Thank you, my dear. I would love for our audience to hear about just a bit of your credentials, who you
Mhm.
are, what you do, what you're passionate about. And yeah, so go ahead, girl, tell us about yourself.
Well, besides being your friend and co-host for many years on another platform, Dr. Tagni, for those who don't know me, I'm a gynecologist. Actually, I should say obstetrician and gynecologist out here in the suburbs of Philadelphia. And we've been friends since we were like, what, 18 years old?
Yep,
Yep.
17.
70 years old.
hmm
Now mothers learning this in this new season of life, just learning about ourselves in this space. So I'm super glad that you invited me to join and talk about my experience as a mother and my postpartum journey, especially since I'm so fresh in it, right?
Yeah. So Corinne, as she stated, she's an OBGYN and she actually just recently opened up her own med spa called Sabel. So if you are in Philadelphia, you definitely have to check it out, especially for you moms who've had children and want to get things all the way together. She runs
Yeah,
and she
come
runs
see
an
me.
yes.
I'm
She
the
runs an
vagina queen.
Oh my gosh. So, yeah, she runs an intimate wellness spa and she can really get you all the way together. But I am really proud of you, Corinne, because what many of our listeners do not know is that you are a superwoman. You are a brilliant physician. You are a passionate individual, passionate about maternal health. And to be fair, you don't give yourself enough credit. You literally just birthed a child. How many weeks ago?
the My bus is 2 months old.
2 months
My
old.
new bus.
2 months old.
You
This
know,
girl delivered a baby 2 months ago. She recently just opened a practice, and she's here on this podcast to tell us a little bit about her experience, right? Because oftentimes our physicians, we don't see them as going through the same
Mhm.
problems that we go through. And Corinne takes care of women with postpartum issues, postpartum complications, pregnancy, and looking at her, I wouldn't think, oh, my doctor is going through the same thing. And a lot of her patients probably don't relate in that way. And so hearing from her as a physician, as an OBGYN, that she went through the same issues that many of you have gone through, I think is needed. It's humanizing. And so I am just so glad you agreed to come on this platform and share about your experience.
You're gonna make me blush. But thank you so much for just expanding on that as well as you did. It was important to me to come here because I know firsthand how it feels to go through the changes of postpartum
Mm.
from the physician point of view and now from the patient point of view.
Mm.
And like when you told me that you were going to create this podcast, I was like, girl, sign me up. Sign me up. We gotta talk about these. So I'm very happy to be here and I'm an open book.
Yeah.
So Let's
So
talk.
yeah, let's talk. How was your pregnancy? Would you say you had a relatively easy pregnancy? Were things going pretty well for you up until you delivered?
Yes, so I will say that I had an easy pregnancy compared to my first pregnancy. I feel like this pregnancy was a lot easier. Obviously, the advantage of experience, right? Where
Mm,
you think about being a second time mother, you know what to anticipate, you know what's coming
mm,
up with your appointments. So that was very helpful. And also it was helpful not it wasn't in the thick of COVID too, right? So the
mm,
mental experience of it all was different. However, during my pregnancy, actually coming into my pregnancy, I had been diagnosed with hypertension, which is high blood pressure in pregnancy. Not only in pregnancy, but in my case, it was more prominent in pregnancy because prior to that, I was stable, right?
mm,
I actually had a history of gestational hypertension prior to being pregnant. My last pregnancy was complicated with gestational hypertension. So when I transitioned, I felt that things were good. I didn't have any more issues. I continued to see my PCP.
mm,
However, they pointed that I was at risk of developing hypertension because of my history. So starting this new pregnancy, I had few episodes where my blood pressure was high from time to
mm,
time, but for the most part, it was well managed. So I started my pregnancy pretty easy and then started to experience issues further along into
mm.
my pregnancy.
And once you got to the point where you were full term, how many weeks were you when you delivered your child?
So because of the fact that I had developed hypertension, the discussion was to have me delivered earlier than 40 weeks. So we agreed on 37 to 38 weeks with my high risk doctor, which, I complied with, dragging my feet, but I did. And so at 38 weeks, I was induced. I went through the process of induction. And for those who don't know, it's just provoking labor, essentially. So I went in, things were super smooth. This little boy was ready to come out. I was done in less than 24 hours, right?
Mm,
So things seemed to be good. I was happy. I said, well, I did pretty well. I managed my diet, exercise, made it to the finish line, had my baby as planned at 38 weeks, and I was pretty proud of what I had just achieved, right?
mm. Wow.
Until a few days later, where I had to come back with postpartum preeclampsia.
Tell me a little bit about that because I was in the process. I remember you calling me and we were talking about it and the next thing you were in the hospital. So were you experiencing symptoms? Were you feeling bad or were you just monitoring your blood pressure and you noticed it was going up? How did you know that you needed to go back into the hospital?
So I have to say, when when I was discharged and the provider who discharged me noticed that my pressure was creeping up a little bit more than she was comfortable with. And I assumed that I had been sleep deprived for the past 2 days. So it is expected for my pressure to be a little bit higher than usual. But I told her I will be monitoring as promised. I did. So when I got home, I started to check my pressure. One thing that was very evident, which was actually pointed out to me as well, my mother was visiting and she said, you look very swollen. And I said,
Mm,
well, I just had a baby. I expect to be swollen, right? So I wasn't thinking too much about it. And I was also distracted by the fact that I had a newborn,
mm,
juggling a toddler and trying to adjust to this new chapter. My son had some difficulties. We had to go back to the doctor. So I was really just trying to survive that chapter. And it was very challenging to think about me as an
mm,
individual during that process. But I was checking my blood pressure. So once I noticed that my pressure was creeping up, I made a mental note, but I didn't address it right away because I wanted to make sure that my son was good.
mm,
So when we were admitted, we went into the hospital with my son. we were admitted, and during the time that we were there, I started to have severe headaches.
So this was your son. So this is when
My
your
son
son,
admission, yes,
yeah. So
absolutely.
your son was admitted for a different
Mhm.
reason. And while you were in the hospital, you started to notice that you were having headaches.
Yes, I started to notice I was having headaches. And I think part of me was also in denial of the fact that I could be developing preeclampsia because I just couldn't fathom the idea that I will have to tackle another issue outside of dealing with the admission of my son at the time, right? So I pushed it back, and my husband, luckily, who had been listening to
Our podcast.
our podcast, nudged me
Oh,
like, excuse me. It sounds like you have a problem.
I want to pause there a little bit because I always preach about everybody around you needs to be aware of mom, needs to be aware of your body, the symptoms, what to look
Yeah,
for, because
yeah.
oftentimes mom is literally in the thick of it. She's trying
Hmm.
to juggle so many things. She sometimes, I don't want to say it's denial. It's almost like I'm
It is.
feeling these things,
Hmm.
right?
Hmm.
And I know something's probably going to go wrong, but I'm just going to put it to the side real quick and I'll
Hmm.
deal with it at a later time. But thank God for your husband who was like, I'm going to stop you right there, ma'am.
Yeah, yeah.
Can someone
It-
check in on my wife?
yes, that's exactly what happened. So he called the nurse. Mind you, we are there for my son, right?
Mm,
So it's a baby nurse who comes in and he's like, "Can you please check my wife's pressure?"
mm.
And I can't even say out loud the numbers that were read. It was ridiculous. My numbers were really
Was
high.
it 200? How high was it?
So the initial read was 170 over 110,
Mm.
which translates in lay term severe hypertension, right? And I say to myself, that can be real. I'm on the baby floor. What do they know? So, but
You're
it
like, they're
was,
not taking these blood
they're not
pressures
taking it,
correctly.
correct? So, but it was enough to trigger the chain of events that followed, where I ended up, having to address it, having to go down to the maternity floor, being evaluated properly, and that evaluation led to the diagnosis of postpartum preeclampsia. So I must say, looking back, I was really grateful. But in the moment, my husband almost like got the wrath of me because it was a lot for me to handle at the time. I just wanted to focus on my son at the time and make sure that the baby was good. And I couldn't imagine throwing myself in this equation. We were going through so much. So it was very challenging to come to terms with that.
Yeah, I imagine that's really difficult and having to go downstairs and be away from your son. Were they able to work out an arrangement that he could be near you while he was there, or
Yeah.
were you sort of apart during that time that you were admitted?
So we had that conversation real quick, and my husband again had the presence of mind to decide to keep the baby instead of taking the baby home. So
Mm,
we were able to keep the baby with us because I was just starting my breastfeeding journey. My milk supply wasn't quite established yet, so it
mm,
was another hurdle to come to terms with. And emotionally, when they told me clearly I had postpartum preeclampsia, I was a basket. I couldn't
mm,
handle not being with the baby and while
mm,
trying to understand. And at that moment, I was truly a patient. And I remember calling you and letting you know that, hey, this is what's happening. This is the hospital. No, actually, you asked me, what hospital are you at? And I was like, oh, sure. Yes, I think you need to know where I am, right? So I sent you the information. And I had the conversation with my husband. I said, listen, if things were to deteriorate, you need support. And I want you to have outside of family someone who is not emotionally charged,
mm,
who could guide you as an advocate. God forbid something was to happen. So I want you to reach out to Erica, she'll be able to guide you. And he said, why are you saying that? I said, wow, things happen, right? Things happen. And it's something that you and I have talked about enough with
Mm.
our patients that it became so real to me. So I have to put a system in place. What if something bad happens? Who is going to be an advocate for me? Who is going to support my husband? Because we've seen situations like that, you and I, where it's a hot mess. So
Yeah.
it was a very challenging conversation to have, for sure.
Yeah, I can only imagine. You and I both see a lot of complications when it comes to obstetric complications. And I would have to say that I am thinking what you are thinking in that moment, right? You're thinking about all the patients who have had negative outcomes from postpartum preeclampsia. Why do we worry about postpartum preeclampsia, Corinne? What exactly should our audience know that is leading you to this place where you're going through all these scenarios with your husband? What is the ultimate fear that is going through your mind when you're telling him this?
So when the diagnosis of postpartum preeclampsia is established, few poor outcomes that can be very detrimental and debilitating are stemming from the damage that is happening in the body with your blood pressure being so high. For example, hemorrhagic stroke is one of the worst outcome that you see
Mm,
when someone still makes it potentially if they don't pass and they have like no life left, right?
mm,
So you start to have conversations where you have to discuss with your loved one, if there's a conversation where I am not able to make a decision by myself
mm,
because my brain is dead, but I'm still alive with on a machine, what do we do? Those conversations are very difficult, but those conversations can happen in a situation like that because someone may have had a stroke that put them in a position where they are what we call a vegetable, for example,
mm,
right? Now, you also have situations where you end up, the patient passes away, right?
mm,
That's what we've seen in the news. We talk about preeclampsia, maternal
mhm,
mortality, Black women are dying more than, we talk about all of that. Undiagnosed preeclampsia can lead to death, point blank, period, right? So when I'm in that situation, I'm thinking about all the scenarios. My brain is spinning. I've seen so much. Like, what if I'm a statistic today? What happens? Those are the conversations you're having while you have the nurse poking you, trying to get your line in, making sure you don't have a seizure, which is another negative outcome, which can lead to so much more of when
mm,
you have postpartum preeclampsia or preeclampsia during your pregnancy, right? So we talk about those things, and I can expand on all this, the outcomes. Little plug, go listen to Hey Doc, Let's Chat. We
mm.
talked about this topic
We
a
did.
lot.
Mhm,
So all of these things lead us to the conversation about advocacy, power of attorney, like all of those are heavy topics to tackle when you are scared. You're scared. You're just in the bed, scared. And I remember my nurse coming in and holding me, and she told me, "You're gonna be okay. You're gonna be okay."
mm,
And in that moment, I just realized that I was so vulnerable, and that's what I was avoiding, trying to just
mm,
focus on my son. I was avoiding that experience of being a patient. I was avoiding having those conversations in real time because it's one thing to have that in passing in general. It's another to discuss that when facing a terrible situation that can lead to a poor outcome that no one wants to talk about.
I think it is something to go from being the caretaker, the person who's caring for everybody, the person who's worrying about everybody, to now having to get into a situation where you are the one being taken care of. where people are looking out for you, where people are, you can't move, right? Because when you're
Mhm.
getting those medications in the hospital, I'm sure you were getting magnesium, a medication that
Correct. Yeah.
relaxes the blood vessels and tries to bring your blood pressure down with all the other blood pressure medications. And you can't move when you're getting these, right?
Mhm.
You have to sit in the bed, you have a Foley catheter. That experience being a patient, and this is different from delivering a baby when you're a
Yeah.
patient, because
Yeah.
that's a happy time. But
Hmm.
now you've been humbled,
Hmm.
right? How do you walk out of that experience and be able to now take care of your son and be able to initiate it and go through that postpartum healing process? How does that affect you mentally, physically, emotionally, and how are you now trying to parent your son in this moment?
That's a very good question because the beginning of the journey with my son was very different than with my daughter, right? And I'm facing the breastfeeding challenges, and I'm fine, and I'm behind the
Mm,
curveball because I can't keep up with his demand. He was on formula, no, donor milk and then formula because I had nothing. The
mm,
experience of being in the hospital for 2 days as a patient and with him prior as a patient, like completely changed the course of our experience with the breastfeeding journey. And in that moment, I was very humble because I realized that if I wanted to have the joyful experience I was looking for being a mom again, I needed to change my outlook,
mm,
which was I needed to be okay just feeding my son. That's it. Being okay just feeding him doesn't matter how. As long as the
mm,
baby's fed, the baby's happy. Therefore, I must be happy. So we started like that. And I started giving him formula and it was okay. And I
mm,
will pump in between, and pump until my nipples will fall off. And just anytime I wasn't producing enough, I would just top him off with formula. And one happy morning, little boy decided to try the nipple again.
mm,
And he just lashed after a month and just started nursing spontaneously. So that experience really humbled me because I made the conscious decision to be happy. However, I was to feed my son, which was very different than when I had my daughter, because I sunk into depression trying to feed her
mm.
by only breastfeeding her, right? So that was the main difference for me this time around. And I'm very happy I made that decision early on because I really enjoyed the journey with him.
Mm. Good, good.
Yeah.
I know that's difficult to do. And sometimes our prior experiences do can have an ability to inform our next decision. So
Mhm.
you probably had a moment with yourself and you're like, I remember how breastfeeding led me to postpartum depression. I'm
Yes.
already going through this. I'm already in this challenge. Let me accept the process, what I'm in, and let me lessen the load. And let
Yes.
me just give in and allow him to have formula. And even in doing that, probably it stimulated that breast milk because you're decreasing
Hmm.
your stress level too. And in the end, that is a lesson for all of us that some of these things still end up in a positive way.
Yeah, absolutely.
Mhm.
I was very, very surprised. It took a month. It took a month.
Mm,
However, I had, the support in place, right? I knew I could reach out to a lactation specialist. I
mhm,
had my village around me. You called and texted me a few times, like, how are things
mhm,
going? And I was letting people help. And it was very, very, I was very intentional, which I think
mm.
that a lot of times we have mommy guilt. We have
Yeah.
mommy guilt about tapping into our resources, using the people around us, delegating, asking for what makes sense to us as mothers in that moment. For me,
Mm,
very early on, I knew that I couldn't go down the path of breastfeeding only. So
mm,
we divided the night in shifts. My husband took a shift and I took the next shift. It worked out beautifully. He felt empowered to help,
wow.
right? And I'll just put the baby in his hands at the beginning of the night and I'll be, see you later. I'll be back around 2 a.m. And that's it. And it worked out. And
Mm,
but those steps were intentional. They were educated from our prior experience and just releasing the guilt that comes with just trying to be every mother's, like everything that you're supposed to be as a mother, right? And I just refuse to go down that path this time around.
wow. How does your experience with this inform your care for your patients? How does this experience change you?
Oh, it humbled me. It humbled me so much because now I have a lens that has more empathy. Not that I didn't have empathy before. Now I have empathy with experience. It's
Mm,
different, right? Talking to my patients about what may happen if they develop preeclampsia, why are we following up so carefully? Now, having the experience of preeclampsia, it's like a full circle moment for
mm,
me that I didn't want to have, but now I have the experience and that allows me to pull from that toolbox when I'm talking to my patients with a lot more empathy. And I think it makes me a better physician overall, you know?
I love that.
Yeah.
If you had to share with our audience three things that they can take away from your story, just some pieces of advice about postpartum, what would those three things be?
The first thing I will say is do not be ashamed or afraid to ask for help. You don't have to have it all together. Just ask for help. Take the help. It's hard, but do it. It'll make your experience a lot easier. The second thing is pause, be in the moment. Be in the moment. Those weeks, months, they go by quickly. The night may seem long, but they go by quickly. So I say be in the moment, just snuggle with those little ones as much as you can. And finally, be intentional about setting boundaries to take care of yourself. Set those boundaries and enforce them, and people will follow. Take that time to go get your nails done. Take a walk by yourself if you have to, but put that time to take care of yourself. Also being mom, wifey, or all the hats that we carry throughout the day. So those are the things that I will say to my patient now, right? Having the benefit of experience. Yeah.
Yeah. And I would say also taking away from your experience, one thing that I would also, listening to you here is, ladies, listen to your body.
Yes.
Listen to your body. A common theme has been, I have so much going on. I have to do X, I have to do Y, Z, all these different things. And then being in denial about what your body is going
Mm-hmm.
through. The only way we catch these complications, right, is through you voicing
Mm-hmm.
something is wrong.
Mm-hmm.
Or you may be lucky you have a spouse or a pediatrician or lactation specialist who picks up on these things and is concerned. But if
Mm-hmm.
there's none of those people, it's you. And you have to, even if it's a feeling of like, I just don't feel right, be empowered to please get the help that you need, because postpartum preeclampsia is not just any postpartum complication. This thing is taking women out every day,
Yeah,
every day.
absolutely. Absolutely.
Man, now, Corinne, I want you to just tell our audience where they can find you, whether your spa, your med spa, your Instagram handle, all the things. Please drop them so people can get in contact with you.
I knew you were going to put me on the spot. I should have come prepared, but hey, just quickly, I like you did such a beautiful job. So if you guys want to track me down, check out Sibel Med Spa. That is SIBELLEMEDSPA. You can find me on IG. And if you happen to travel to the Philadelphia area, come check us out. We are located in Horsham, PA. Check out our website, Sibel Intimate Wellness. We talk about anything and everything intimate health. We get you back together. We talk about sex. We talk about and pain with intercourse, anything that can interfere with you enjoying intimacy, I'm your girl. Come find me.
Yes. Oh my goodness. Carine, thank you so much for sharing your story.
Thank you for having me. Until next time.
Until next time. Thank you for joining us on this episode of Fourth Trimester Voices. If you have any questions about today's episode or you want to share your story, please email us at fourthtrimestervoices@gmail.com. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.